These days, many people with illnesses have an oximeter at home to check their oxygen saturation. They are a nifty little device and are fairly accurate. Even our watches, depending on the kind of watch you have, can monitor your oxygen level. And in fact, I recently had a patient and his family insisted on keeping his watch on him during his dying process so that they would know what his oxygen levels were. I think this kind of technology is here to stay, and it gives patients and families a sense of control and knowledge and comfort. So I no longer try to discourage people using this kind of technology. I will say I have only been using an oximeter for about the last 10 of my 35 years of practice in hospice, and people die just fine before knowing their oxygen levels. We do use it to help gauge where they are in the process. It also shows the heart rate. Being an older nurse, I still check patients' pulse the old-fashioned way by touching them. This gives me more information than just a number. It is always accurate, and I can feel how strong or how weak the pulse is and how it changes in different parts of the body, like the wrist versus the feet. The same is true for oxygen levels. We can see changes in the body as the levels decrease or change. What is important to know about the oxygen level is that as patients transition and get farther into their active dying process and toward death, it's expected and normal that the oxygen levels will decrease. And as the pulse gets weaker, the accuracy of the O2 level and the heart rate in these monitors is less. In hospice, we are not concerned with the number, but rather the comfort of their breathing. We know that the oxygen level does not always match the comfort level of their breathing. It is not uncommon for a person to have an excellent oxygen reading but feel very short of breath. And vice versa, a patient can have an oxygen level of 60% with no signs of breathing difficulty. A normal oxygen level is 90% or more. We watch oxygen levels change with activity or deep breaths. We see how quickly someone O2 recovers after dipping due to activity. Again, hospice focuses on treating and preventing breathing or respiratory distress of any kind. We do this with medications and interventions. You can find more information in our breathing section of our hospice care plan. The hospice care plan has all that information. So to sum it up, if oxygen level, knowing it gives you comfort, use it. If it's a source of anxiety, then don't use it. You can find out a lot more at our website, the Hospice Care Plan. You can get a copy of our booklet, the Hospice Care Plan, going over care and symptom management. You can also go to our free YouTube site with over 400 videos on care and symptom management. And there you can see what you need to see and like and subscribe. Thank you.